Hi, I'm Vincent Ledoux and I'm COO and co-founder of Vesalius Cardiovascular. We are a Vancouver-based medical device company designing and developing a surgical implant to replace open heart surgery. The disease we are dealing with is called mitral regurgitation. And this is a leak inside of our heart, affecting millions of people around the world. Current standard treatment is open heart surgery. It is effective, but it comes with a high risk, and due to this risk, there is a large number of patients who cannot undergo surgery, and this is a serious unmet clinical need. At Vesalius, our goal is to replace the open heart surgery with a transcatheter intervention, and our role is to develop a surgical implant that will allow us to replace the surgery itself. So basically, our small implant will be designed based on the surgical principles, will be delivered through a transcatheter intervention. So basically, you'll be using our vein to be introduced to the heart. And inside of our heart will be deployed and will mimic the surgery, providing safetiness, effectiveness, and also durability. How does it work? So the disease itself concerns the mitral valve. And the mitral valve opens and closes with two leaflets that look like French doors. When the valve is diseased, basically one of the leaflets doesn't coapt anymore with the other and basically allows the blood to flow backwards instead of continuing to the aorta in one direction. The surgeon during open heart surgery sutures this leaflet back to the papillary muscle, so attaches it. And basically this leaflet cannot go to the other side anymore, but basically coapts again. We have discovered at Vesalius that this suture does not need to start at the tip of this door, at the tip of this leaflet. It can start much higher at the atrium level. And it doesn't need to be a suture, it can be a net, because 1, 2, 3, 4, 5 sutures equal a net. At the same time, we can attach this net to a stent made out of nitinol. Nitinol is a material already used in surgeries for years. And basically, whenever our net sits on the leaflet and covers it, and basically is attached to the papillary muscle, it will provide the exact same effect as the sutures and basically repairs the valve, with one difference, without the surgery. Our team is complete. So Peter Skarsgård is the head of cardiovascular surgery at Vancouver General. He's leading this initiative. He's extremely committed, and he's providing a lot of his time to this project. We also have Jackie Saul with us, who's a structural cardiologist, and she's helping us with the delivery technique. Ian McDougall, 22 years of biomedical engineering expertise, 5 different startups. He's leading the engineering. And myself on the operation with 20 years of experience between finance and startups. We also have 2 other doctors helping us on the surgery side and the echocardiography, the imaging side. Why are we doing this? We're doing this because we want to transform a 7-day of hospitalization, open heart surgery, to an overnight stay in treating this disease. We also want to divide the costs by more than 3. More importantly, we want to reduce the hard recovery of the patients. An open heart surgery recovery is today between 2 to 3 months. We want to transform this into 2 to 3 days. So imagine a patient going to the hospital on a Friday, Saturday he's back home, and Monday he's back to work, or maybe back to play golf, or play with his grandkids, etc. Finally, a 6-hour operation will be transformed into 2-hour procedures. So basically our solution will be saving time, money, and of course energy. We are currently at the engineering phase, and this phase will last for 12 to 18 months from now. It will be followed by a re-engineering, because engineering will never stop, but also animal testing. And we are aiming to reach the first-in-man study, so the clinical first-in-man study, in 36 months from now, in 3 years from now. There's a comparable in this field, a company called Harpoon. This is a 4-year-old company. They invested, or they raised 5.5 million. They finished the engineering and started the animal testing, and then finished the animal testing to first-in-man, and then they were acquired just around the first-in-man for 250 million. Why? Because this market is huge. It's estimated to more than 13 billion a year. So at Vesalius, our goal is to allow every patient suffering from mitral regurgitation to be treated but to be also treated in a very simple way, in a straightforward way. We also want to save the system, the institutions, the insurers lots of money. We also want to treat much more people than before, because basically we won't have a wait time. And also, and more importantly, we want to participate in the evolution of heart treatment. And there is a huge revolution there, because everything is moving towards transcatheter interventions. And this is where Vesalius is going to.